So I do have a lot of special patient memories. One very early one that comes to mind is when I was a resident and I realized the impact of our work that it can have on people. There was a 90-year-old lady who I was lucky enough to do her cataract surgery, and on her post-operative appointments she would come in and she was dressed nicely and she had her fingers painted and she was showing them off, and her granddaughter who was with her told her she wanted me to notice that she was able to start painting her nails again and start taking care of herself again. And so it really instilled in me the idea that when we bring vision back to our patients, we are able to give them independence. And so that's one thing that I'm really proud of. Through our work, we're able to make people who might start becoming dependent on other people, we can bring back that independence and make them able to live their lives like they used to. I chose ophthalmology for a few different reasons. Number one, we are able to change a person's life pretty quickly. So they can come into our office. The very next day, we can either get them out of glasses or reverse vision loss that they've had over the last few decades. And so that was a really powerful and compelling argument to me as I rotated through all of the different things I saw in medical school. I found that we had the biggest impact on people's lives through vision. About a third of the brain is involved with vision, so it just tells you how much of visual creatures humans are. And to be a guardian of that special skill for humans, I think was important. The second reason is that when we look inside of the eye, we can actually see a lot of other disease processes that are going on. So high blood pressure, diabetes, that sort of thing. We can actually be the first doctors to tell a patient, hey, you should go check this out. We think you have high blood pressure. So not only can we protect people's vision, but we can protect their overall health. My inspiration, there's a track record of different mentors in my life that have pushed me into different parts of who I am today. But starting with my godfather, he was a general surgeon. I was able to see the compassion and care he gave to people who were strangers to him, who came in. I saw the power of taking care of folks who you might not know initially, but you get to build those relationships with them. And it was interventional. He did a different type of surgery than what I do, but seeing that you can intervene and help somebody was really powerful. So that was when I first started realizing I think I wanted to be a surgeon. As I moved on, I was able to have a bunch of different mentors through med school and residency who I wanted to emulate. Dr. Tyson is actually one of my inspirations now. He's somebody that I look up to and want to emulate. And so I really owe who I am today to not just my godfather, but all of my mentors through med school, residency, and even now. So my parents taught me quite a few principles that have stuck with me. First off, we are Greek American, so my parents are from Greece, and so I'm first generation. That in itself has taught me a lot about hard work and the benefit of living in somewhere like America. We've got a lot of opportunities here, and one of my first principles is don't take things for granted. And so compared to folks all around the world, hard work doesn't always pay off, but in America it typically does. And so we are very hard workers. I've been working here in Cape Coral since I was 12 years old at our family store. We had a health food store, and so I had my first job there, and it just continued on from there through college, med school, residency. So hard work is instilled in us and was one of my core principles. And then taking care of family, making sure that everybody is happy and healthy is another big principle of mine, and the community too. So in Greek culture, making sure that everybody around you is taken care of is a big deal. And so I can't see a better way of doing that than making sure that we take care of our community's vision. And it's one of the main reasons I decided to become a doctor. So I consider myself very fortunate to be at Tyson Eye. I spent 5 years as an academic physician scientist at the University of Colorado. And I knew that I wanted to move back home and be closer to family. I grew up in Cape Coral, and so finding a practice like Tyson Eye was sort of a dream. It's been family owned for over 40 years. It is run by physicians who I would trust to take care of my family or my own eyes, and I get great mentorship from the physicians there. So in my mind, there's no better practice that has the latest technology, the best surgeons and in an area that is special, which is Southwest Florida, than Tyson Eye. And so I consider myself very fortunate to be able to be part of the family. People will come to us with vision that might not be as good as it used to be. And a lot of folks will take that for granted. You know, we go through life very dependent on our vision, and we might not realize how much poor vision can take away from our quality of life. People just assume it's part of the natural process of getting older, and they don't maybe realize that we can actually reverse their vision problems and get them seeing like they used to when they were 20, 30, or 40 years old. And that magical moment when somebody sees us after surgery and realizes that yes, their vision is back to how it used to be, and wow, how much worse it got over the last few decades. That moment of seeing them return to their old self is something that sticks with me every single time, and it doesn't get old no matter how many times we do it.